implant is basically a replacement for your own natural root. When you lose a tooth, the tooth that you can see isn't the only part of the tooth that there actually is. There's a root to it that sits in the bone that supports the tooth. So when the tooth is gone, so is the root. So what we do is we put a titanium metal root back into the bone, and we allow the bone to grow onto it. And once the bone grows onto that root, then it's solid enough to place an artificial tooth onto it. And that's essentially what an implant is. When you have there's a couple of ways to do it. If you are about to lose a tooth, then sometimes it's possible to take the tooth out and put the implant in straight away on the same visit. The majority of times though, what we do is we take the tooth out and make a partial denture or a temporary prosthesis of some kind and wait 6 weeks in order for the bone and the gum to heal a little bit, because oftentimes there's infection there, and we don't like to put implants into areas of infection because then that calls for a failed implant. So we wait for the healing to take place, then we go back in at 6 weeks and put the implant in and cover it over for about 3 months. That 3-month period allows the bone to grow onto the implant and get a solid connection. Once that's happened, then we can put the final crown or bridge or whatever it is we're going to be using. Well, I've been placing implants for over 10 years, and the last audit was nearly 2,000 implants. Success rates, my own success rate is over 97%. By success I mean 97% of all the implants I've ever placed are still functionally fine. Global averages are around the 95-96% mark, so I'm quite happy with my success rates. The benefits of dental implants are if you've lost teeth, if you've lost one tooth or multiple teeth, then the alternatives are often quite destructive. Like for example, bridge work. A bridge is when you use the tooth on either side of a space and you cut that tooth down to accept a crown, but the two crowns are then linked together to make a bridge. Now that's okay in theory, but it's quite a destructive thing to do, to cut a natural, sometimes healthy tooth, and thereafter it's no longer healthy. It's then got a lifespan which you just shortened. So it's detrimental to adjacent teeth to use alternatives like bridge work. Sometimes there's no other alternative, you have to use bridge work, but in most cases if it's possible to put an implant in, that's kinder to the adjacent teeth. The other issue is that sometimes people won't have a bridge done and they'd rather have a denture. Now a denture is loose in the mouth, you can feel it, there's a covering to the roof of the mouth, it doesn't feel secure, and many times people have to adjust what they eat and how they eat in order to wear a denture, and it also affects your taste. If you can't taste your food properly, then you change what you can eat. Whereas with implants, when an implant goes in and it's functioning well, more often than not the patient forgets that they have missing teeth because it looks, feels and acts just like a natural tooth. The surgery part of it is not painful because the patient's anaesthetised. There's no pain whatsoever during surgery. Afterwards, there's always a little bit of discomfort, but I wouldn't say that it's severe. I give all my patients my mobile number and I ask them to feedback to me on the evening of the treatment. And more often than not, people will say to me, they'll text me and they'll say, I'm completely comfortable. I've taken my painkillers, I'm not in any pain, thank you very much. And I'm quite happy to show my patients texts from my other patients, my previous patients, to back that up. The day after, there will be even less discomfort, and the following day, usually there's none. There will always be a little bit of swelling, purely because it's a procedure that requires stitches, etc. And the gum is generally a little bit swollen, but nothing that's too uncomfortable. Again, that depends on the complexity and the amount of treatment that's required, but there are finance plans available. Our practice manager, Avril, is very happy to go through finance options which can be interest-free, and it can be spread over a period of time to make it as affordable as possible.